We are live now. Good morning, one and all. I'm Dr. Smarnika from the IEP Digital Media team. I will be the host for today's webinar on trimester-wise care on pregnancy with resource person Dr. Vishaka. The Indian Association of Physiotherapists is the oldest and largest body of association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle the Zoom platform, webinar live streaming, IAP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow IAP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know more about the recent updates on physiotherapy. Subscribe to the IAP YouTube channel for notifications of our live webinars. In the playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, and cancer rehabilitation, etc. for their easy access. The social media links will be shared shortly on the chat. With this, I would like to invite Dr. Sadhvi to start with the introduction of our resource person, Dr. Vishaka. Dr. Sadhvi.
Yes. Good morning, one and all. It is my privilege to welcome Dr. Vishakha Nagraj, a distinguished consultant, obstetrician, and gynecologist currently practicing at Fernandez Hospital, Hyderabad. Dr. Vishakha holds an MBBS, DGO, and DNB in obstetrics and gynecology and brings with her extensive clinical experience and academic excellence in women's health. Her areas of special interest include emergency gynecology, endoscopy, gynecological scans, and OASI repair, where she is known for her precision, patient centered approach, and evidence based practice. Working at Fernandez Hospital, one of India's most respected centers for women's and maternal health care, Dr. Vishakha has been actively involved in managing complex OBG cases while also contributing to teaching and clinical training. We are honored to have her share her insights and expertise with us today. Please welcome Dr. Vishakha Nagraj. Also, for all the Q&As, you can put it up in the chat box below. Over to you, Dr. Vishakha.
Good morning, everyone. Thank you so much for such a wonderful introduction, Dr. Sadhvi. I'm here today because Dr. Smarnika had asked me to talk about the trimester-wise care in pregnancy. I know the topic is actually very vast. Also, to concise it and to try and answer a majority of questions may be a little difficult, but I will just try and make sure that most of the most commonly asked questions are answered, and you at least get an insight of what we do and how to answer questions when the mothers are asking. So I would start my I would share my presentation now. Also, I would like to thank and say share that we also have a lot of when I got the invitation from this physiotherapist association, I was very delighted because we also share a lot of repo with our physiotherapists, and we have a specific department which works with the mothers with birthing positions. They do work with them with the mothers who have had disc bulge, disc prolapse, or any kind of sports injury. So we really have a dedicated physiotherapy department. Also, they help to the mothers postpartum also. So I'm very delighted to have so many physiotherapists here, and I would start my um, uh, lecture on healthy pregnancy care and safety. I would take you through basically first the 4 or 5 major things which are generally asked, and then I would also share a trimester wise rough care, not rough, but a basic plan on how to do a trimester wise care. Still, if you have any questions, please put in the chat box. You can interrupt me and ask me, because if you got forgot in the end, or really you don't feel that it's matching with what you do, then just let me know. We can discuss in between also. So this is a slide which I have put up. I have got it from the internet, obviously, but I actually, when practicing obstetrics for so many years, I didn't imagine that this is how much a mother goes through while she is giving birth to. Can you see from it's from head to toe? There's not a single organ which is left, which is not affected by pregnancy hormones. And if you think about it, your body is going through the changes of pregnancy, getting prepared for every month. So you have these, actually, obviously, the during pregnancy, the amount, the quantitative thing will increase, but at least for the basic part, every woman goes through changes, all these changes every month. Her body is getting prepared for that. So I think we cannot even count what all is listed in the picture. So can we really have a control on it? Can we really prevent our mothers from experiencing such harsh symptoms? Can we really help through them all this? I think we can make the women understand and take care of herself. That is the main thing. The main thing is that they should understand the physiology and understand their own body, and then take care of themselves. So what does pregnancy care include basically? It is essential preventive health care provided by midwives, doctors, or any other paramedical medical staff to ensure that both the mother and the baby are healthy. Now, when we talk about comprehensive care, we talk about the medical personnel which will be involved. They can be doctors, they can be junior doctors, they can be super specialists, they can be physiotherapists, they can be midwives, they can be sometimes when you are in the labor room, even the daya who helps you out every day in and out, sometimes they can't turn out to be the most experienced person because they have been doing it for so many years. So including that, they all form the comprehensive care of women during pregnancy. When we talk about a comprehensive care, first of all, we have to identify the mothers who are high risk. You have to differentiate between the mothers who will be high risk and the mothers who will be low risk. High risk may include mothers which have any medical conditions or any surgical conditions, or they may be suffering from any mental disorders. So, all these considered to be high risk mothers. Now, those need special attention. They may need super specialists. They may need, for example, rheumatoid arthritis, or mothers who are multiple sclerosis or scleroderma. They also need a medical personnel like rheumatologist, or cardiac disease. They need a cardiologist. So, identifying first of all high risk and low risk is extremely important. Then, second, we need to tell them what precautions they need to take in every trimester. The other thing is, which we need to tell them, is about the do's and don'ts during pregnancy. And the most important, very important part of pregnancy care is whom to contact. There is so much of information available all over the internet, and how you tell your mothers not to see the internet, not to google their own conditions, they cannot resist it. There are reels and reels and reels on Instagram available about pregnancy care and everything, but you should develop so much confidence in your patients, so much confidence that the mother who comes to you should have as a medical personnel in you, that the first person they contact is you and not go to google. That is how your winning the war starts, I would say. So concentrating on healthy mother and baby, I forgot to mention the neonatologists, For high risk pregnancies, you also need a neonatologist, which you're suspecting a preterm labor, twins, all those things. So, neonatologist also forms a very important part in the comprehensive care of the women. So, all of us, including all of us, should aim towards healthy mother and baby. Now, as I said, this is the most important part. Assess the your lady. How do you say that um, assess health that she is high risk or low risk? So first visit when she comes to your clinic or anything, you need to have a flow chart of things. You have to have a history. You have to ask her medical history. You have to ask her surgical history, family history, any history of cancers in the family, any surgical procedures she had undergone, allergies. This is a proper set of taking the history. Once you have taken the history, you will be sure what risk you need to take. For example, a mother who has been under infertility treatment and she was a known case of polycystic ovaries, then we know that she may be a high risk for having gestational diabetes in her pregnancy. So that mother you have to identify and do an early OGTT to see that she doesn't develop gestational diabetes in her pregnancy, or if she develops, it's an early detection and you can take care of that. This is how, when you prevent the complicate, when you assess the health, you prevent the complications. Once you prevent the complications, obviously you reduce the mortality and the morbidity. See, mortality in a setup tertiary care center is bound to be less. It should be less. There you cannot say that we have a high mortality, obviously. Morbidity is what we are more worried about here. Morbidity means, suppose a mother is gestational diabetes. If her sugars are not controlled, she's bound to have a wound infection. She's bound to stay in the hospital for a longer time. So, assessing health, preventing complications reduces morbidity. Basic morbidity is, if you see from a patient's point of view, if a mother's or a family point of view, it will be least stay in the hospital. So that's prevention of morbidity for both mother and the child. Once she has given the birth, you have to promote well-being and prepare her for parenthood. So these two things have to be inculcated from the antenatal period so that she takes a very good of herself, and then you can prepare her for parenthood. See, we all of us talk so much about antenatal care, about the pregnancy, about everything. But the second part, which is very, very important, is lactation. Nowadays, mothers are finding it extremely difficult for lactation because they are not prepared for it, or they don't know that it is very difficult. So, lactation also is a very important part which you should include in your antenatal care. We do have lactational counselors, and I'm sure you people, everybody must be knowing there will be a lot of lactational counselors who help them throughout the pregnancy in the third trimester to see their nipples, see if there is any cracks, see if they are retracted. So that is how you prepare them for childbirth and parenthood. Now, these are the four C's, the four main C's of pregnancy care. One is choice. The mother's choice to be with a midwife, to be with a doctor, to be with any antenatal care unit, or what kind of care she wants. Once she has made a choice that she wants to be with the doctor or the midwife, or she wants to have a collaborative care, then there should be continuity of care and carer, both. You should know the patient should be so confident in you that she should come back, and you should know what is going to happen for her next examination or her next visits. Communication is extremely important. See, when we are into the medical field for a long time, we tend to believe that ये तो पता ही होगा, this everyone will know, but it's not the case. Like, we may not know very nits and grits of any other profession like hotel management or cooking. So the wordings, the medical jargons, we cannot use on them. We have to tell them in their simple language. So, if any question asked by the lady or the mother is not small, you have to answer each and everything, and take a note that whatever she is asking, you answer in her own language. She should have an emergency contact number, either of the hospital or of the midwife or anyone who is taking care, the doctor herself or the junior doctor, whom in the time of emergency she can contact. I know it is difficult, but there has to be an emergency number. We at Fernandez Hospital have emergency numbers of the labor room of all the three IP units, all the 24/7 available for the patients. So once you do follow the choice, continuity, and communication, it obviously improves the continuous quality, the quality improvement. So when continuous quality improvement, which also includes that you have to see what you have done for other, like you have to keep your own record that you did this and the outcomes were better. You did not do this and maybe the lady had some kind of small complication, or suppose you have a urine culture report, for example, and generally urine culture is treated when it is more than 10 to the power 5 of organisms which we see. But sometimes, even if it is 10 to the power 3 and the patient is symptomatic, you may have to treat her. Then you have to improve the quality of care. So once you see and you start doing it, you will know, and your outcomes will automatically improve. So these four C's: choice, continuity of care and carer, communication, and continuous quality improvement is extremely important. Now, I have actually, when the topic was given, they told me to do it as trimester-wise care, but I have little tweaked it, and I would like to do it first. How the most commonly asked questions are, because these are commonly asked questions in every trimester, whether it's first, second, or third. So, these are the most common questions which are asked in the clinic. And when we are talking all about your sugars, your diabetes, your BP, your health, your iron, calcium, vitamin D, and everything, she has some other things in her mind going on. So, these are the most common questions I have noticed which we get in our clinic, which include the safety, about nutrition, physical changes, fetal well being, and drugs. Most commonly, which I want to tell my ladies, my mothers who come to me, this is a basic chart which I have made in my own mind. This may not be very um, from the literature or anything, but these are few things which I tend to say in every trimester, like eat healthy, balanced meals, avoid junk, attend regular antenatal visits, take medicines only as prescribed, do safe exercises, maintain posture, get adequate rest. Now, get adequate rest has two what do we say, two ends to it. One is when we say rest, they won't move at all. One is when we say that pregnancy is physiological and you can do your routine work, they tend to do too much of it. So adequate is what changes for every mother. The other thing which I say don'ts, which are absolutely no for our ladies, is do not self medicate. Alcohol, smoking, tobacco is to be avoided. Avoid heavy lifting or strenuous work. Do not take herbal remedies without advice, and do not ignore warning signs. These are very, very important. Do not ignore warning signs is one of the major things which I would like to tell my mothers. Now, this is the most commonly asked questions in pregnancy: travel, medicine, nutrition, exercise. Apart from our medical point of view, those medical point of view we will still do, but these questions are absolutely asked by the patients. Now, what is this? This is a pregnant lady traveling. Now, I don't know what is it about, but the first viability scan ke baad, whenever I say congratulations, you are pregnant, your baby's heartbeat is seen, the baby is growing properly. The first question I get from the lady or the husband or whoever with the accompaniment is, ma'am, can I travel? I'm not sure uh, what are they talking about. I mean, the first question they ask is, ma'am, can I travel? So I have broken it down in a sort of few questions when they ask me. When they ask me, can I travel? I say yes. But then it further breaks down to how much you can travel. It depends on your own body. Your body should not be tired. You should not feel tired. You should be able to do your own work at your own pace. Second, can I travel may? It also includes if you are not a high risk. That means you did not have any previous miscarriages. You did not have any vaginal bleeding during this pregnancy. Twins, I generally tend to say better to avoid a travel, though it's not an absolute, but still travel a little less. And fourth thing is, which we really need to consider and really need to be considerate about, is their financial condition. Because some ladies are working in remote areas for most commonly profession, which I feel is suffering is the teachers. They have to stand. Then again, if they are in a government job, they are going to some remote places, which is around 30 kilometers, 40 kilometers. So I really don't know how to help them because they can't be even prescribed work from home. So that is another very big issues. For teachers specifically, I tell them if you can sit and take the classes, if you have been traveling for 25 or 30 kilometers by road to reach your school, it would be better. Other thing I tell them is do not take any extra work in their school hours if they are traveling a lot. I mean, they will have a lot of project works and all those things that I would advise them not to take much of them. But obviously, we cannot say a no. So, traveling is something which has to be advised and which has to be taken according to how the mother is responding to her own pregnancy. If she is vomiting so much, you cannot advise her to travel. She has to sit at home. If she is having vaginal bleeding, she cannot travel. Then, third question is mode of transport. Now, everyone considers air travel to be a very good mode of transport. It is, no doubt it is because it takes very less time. But the thing which we tend to forget is 2 hours sitting in the airport, then in the plane, then again 2 hours, 1 hour maybe getting down, taking your bags, then again 1 hour in cab. So it actually tends out to be around 8 to 10 hours, 7, 8 hours to minimum. So if it's a small travel, like if the train reaches by 6 to 7 hours, I would say go by train. At least you can move in a train, you can drink water, you can eat, you can lie down. So train has its own benefit, but air and train travel is okay. If traveling by your own vehicle or by car, then stop 1 hour, 1.5 hour, take a walk, and then again you can start the journey. Now, what are the precautions while traveling? You have to have hydration, movement, loose clothes, carry your medication. Please make sure to tell your mothers they should have a companion when they are going because if any inadvertent thing happens, they should have somebody. The best time to travel is second trimester. As I already said, precautions while traveling, travel accompanied, hydrate yourself, consult your doctor prior to traveling. Take a sun protection because it's too much of, some will have allergies, some will have sunburns. Walk as much as you can in between when you're sitting. Or you can tell them to move your fingers if they are going for a long haul flight or something. They have to move in the aircraft, they have to keep on moving fingers. If if there are two long hauls, you have to consider meet a medicine person, and if required, they have to be given put on blood thinners also. Avoid tight clothing or loose clothing. It should be. What to do in a stay? Do not carry weight. Do not self medicate. Look for a hospital at the destination. Avoid exotic destinations is because the food, you may not be used to the food, there may be too much of crowd, so the chances of having infections is very high in exotic destinations. Food and water, as I said, please carry your own water and food. When not to travel. Date near EDD. All air travels close after 34 to 36 weeks. Some airlines do advise up till 36 weeks also, but mostly 34 to 35. Risky pregnancy, twins, vaginal bleeding, previous mid-trimester miscarriages, BP, sugar during pregnancy, heart diseases, and severe anemia. If there is something which is called as placenta previa, that means the placenta is low down in the uterine cavity, you should avoid air travel. So in a short, second trimester is best time to travel. Travel with a companion, hydrate well, and avoid a high risk pregnancy. The second most important question which is asked in any antenatal clinic is, what should I eat? What should I eat? When to eat? How much to eat? What not to eat? These are the most very common questions which are asked. Again, when we talk about nutrition, we have to first understand the physiology of a mother, which changes during her pregnancy. The basic metabolic rate increases by 5% and by 12% in the second and third trimester. So she obviously needs a lot of calories, but that does not mean that she has to eat for two, which is the most common myth. 300 kilocalories more than what you take is enough. Then vomiting. If she has a lot of vomiting, you cannot ask her to take a lot of heavy food because she won't digest it. She will just vomit. So small, short, frequent meals is the answer. Third is absorption of B12 in the later pregnancy decreases. So we have to advise her, either give her a supplement or advise her to take B12 food more during the later part of the pregnancy. And also let her meet a dietitian and take an adequate intake of macro and micronutrients, which would lead to normal fetal development. Now again the thing comes is to identify the high risk mothers who can be undernourished or overnourished. So you have to identify pregnancy which is advanced maternal age, which may be more than 35, or adolescent 18 to 20. Those who have low BMI or very high BMI, because in low BMI you have to ask them to give high calorie food, while in those which have a very high BMI, you have to ask them to restrict their weight gain as much as they can. So dietitians involvement is very important. Though the normal weight gain in pregnancy is said to be around 10 to 12 kgs, but still when you have a BMI of more than 30 or more than 35, you don't want to gain more than 5 kgs, which will always obviously the baby, the fluid, and the placenta. So if possible, BMI more than 35 should be no weight gain actually, but it can't be, but as much as possible minimal weight gain. Now one thing I would just want to add in this is, if a lady is seeing any medical personnel prior to pregnancy and she has increased weight, it would be better to advise her to reduce at 10 kg and then plan pregnancy. That's always better. Then we have to identify the ladies who have absorptive malfunction or multiple pregnancies or on very fat diets, which we can see these days. A lot of people are on a number of diet, GM diet and keto diet, and I don't know what all kind of diet. I've done any, so I don't know. But there are multiple type of diets also. Obviously, smoking and alcohol should be avoided. Why on diet? Because some of the diets may be very what do we say, lacking in certain micronutrients, which we cannot allow, because micronutrients are also very much required for the healthy growth of the baby. So dietitian appointment at least once in pregnancy. I would suggest once in every trimester, but once in pregnancy should be must. So these are the basic things which we need to tell them. One is iron, calcium, folate rich food, high protein diet, but enough carbs. High protein diet is for the formation of the new being, but you also need to sustain your energy. So enough carbs, fluid intake, avoid junk, seafood. I'm talking in Goa and Goa Physiotherapist Society, but asking to avoid seafood, I know that's not correct. But basically, high mercury. So, high content of mercury. Also, what I prefer to tell my ladies is, don't try anything new. By that, what I mean is, we don't know what you're allergic to. There are very few medications, though hydrocodone can be given to everyone, but still there may be not be many medications which may be able to give you while you are having a reaction. So it's better to avoid anything new and avoid anything which is raw. It will be filled with all the ova and cysts of the worms. So, doesn't make sense to eat anything raw. Everything should be cooked. So, fruits and vegetables, whole grains, fiber, B vitamins, these are few examples of that. Lean proteins, lean meats, poultry, beans, lentils, tofu, nuts, dairy products, yes. If depending on the BMI asset, fat, low fat or non fat milk, yogurt, cheese. Healthy fats, this I want to highlight as it's very important for fetal brain and eye development. So healthy fats are very, very important. Avocados, nuts, seeds, salmon. Iron rich foods obviously for the maintenance of hemoglobin, and folic acid in the initial part of the pregnancy. So nutrition, education and regular antenatal care is very, very important. It is important for the maternal health as well as optimal fetal growth. So, key nutrients: iron, calcium, folic acid, protein, iodine, and DHA, and healthy eating habits, appropriate weight gain, and food safety practices. As I said, raw food, high mercury food, don't eat anything new. Water should be taken care of. Don't drink, just pick up any water from any tap and just drink off. These precautions should be taken. So, dietitians advise if you have any of the malabsorption issues or malnourished or obese, and strict following of the diet is extremely necessary. Now, the third part, the third question most frequently asked is exercise. How much can I exercise? The simplest answer is which is beneficial for you, done under professional guidance, and doesn't tire you is the best exercise. So for first trimester, that is from these is according to the ACOG guidelines, that is the obstetric American combination of obstetrician and gynecologist. The first trimester, 150 minutes of moderate aerobic activity per week. It is per week. So it's almost 20 minutes per day and two strength sessions only per week. How do you test that this much is okay for me? That is talk test. You should be able to speak in full sentences. Walking, swimming is considered to be very good because it also helps to maintain your posture. Prenatal yoga, light weights, and modified planks or crunches you can do. What to avoid? Contact sports, hot yoga, scuba activities, and those with which have a fall of risk of fall, that is skiing or horseback. Second trimester. So as you progress to second trimester, though you start feeling better, there is a little bit of weight which is gaining up on the mother. So you have to avoid activities, as I said, like skiing, contact sports, karate, which can actually injure you. And but you can continue with walking, swimming, and pre-pregnancy exercises, yoga, as long as it isn't high impact or lifting weight not over 25 pounds. Third trimester, if you have tolerated these exercises well, then swimming, walking, biking in a reclined exercise bike, not cycling, it's an exercise bike, prenatal yoga, weight resistance exercises, and lighten the load. You cannot pick up the same load in first, second, and third trimester. You have to change. It is to be done according to the trainer. Now, when to stop the exercise? This is very important because they need to know when they have to stop. When there is bleeding or any kind of brownish or watery discharge, when there is pain, calf pain or chest pain, shortness of breath, headache, or fainting. These are the warning symptoms of you have to stop doing the exercise. You can take the rest and again you can again start it. So it has to be under guidance. Stop when needed. Identify high risk mothers. This is multiple times you will hear this. Identify high risk mothers. Identify high risk mothers. This is most important. And exercise capacity is different from person to person. The most important part is drugs in pregnancy. Why drug safety is so important? Because most of the drugs can cross the placenta and they can reach the fetus. Now, when in the first trimester, the baby's organs are developing, so it may harm those. Some drugs may cause birth defects, all the medicines, not some, all the medicines will act differently in pregnancy. because your body, the volume, the plasma volume has increased, your heart rate is increased, your respiratory rate is increased, your liver function tests have changed, your kidney function tests have changed. So every organ of your body is working differently. So when you're taking any medication, the way that the body will excrete it out after its use is done will be different. So that is why the drug safety is so important. This I have listed the categories of the drugs which can be given. I mean, we do divide the drug categories in this basically four five categories, in which the category A is it is safe, controlled studies shows no risk to fetus. Most common example is folic acid. Category B is animal studies show no risk, but human data is lacking or animal risks are not seen in humans, which include penicillins, metronidazole, which is most common, ampicillin, amoxicillin, anything of third generation cephalosporins, they all come under this category. Category C, animal studies show risk, human data is inadequate. But if used, the benefits outweigh the risk for the mother. Then they can be used like this antidepressants like sertraline. Some migraine medicines like sumatriptan, but generally migraine medicines we avoid during pregnancy. Category D is positive evidence of fetal risk in humans, but benefits may justify use, such as life-threatening conditions like phenytoin or lisinopril. Category X is high risk of fetal harm, absolutely contraindicated. Alcohol, isoretinoin, and certain statins. Isoretinoin is used left, right, center these days for various skin conditions. Though topical, isoretinoin vitamin A has to stop. So preconceptionally only you have to tell the ladies that isoretinoin is not at all safe. So drugs should be only on prescription. Check all the medications which you're taking. There are so many. One good thing about internet is that it makes you aware of a lot of things. So there are so many reels which show that two drugs have similar picture or they look very similar. So it's better that you read every time what you're taking. Dosage as advised by your healthcare provider. Now, these are few which I have listed. Antibiotics like tetracycline should be avoided, doxycycline, tetracycline. They cause the teeth damage in the fetus. Anti-cancer drugs like methotrexate, which are used for rheumatoid arthritis. So, patients who are on methotrexate have to stop the drugs 3 months prior to getting pregnant. Isoretinoin, as I said, and very common, very common, diclofenac. Oral तो ठीक है, they will not take, but Volini gel, all kinds of amnio gel and all kinds of gel. So ask them all. This is very common because they'll first ask, Madam, backache ho raha hai, what can I put? So you have to tell them, read it. If it has diclofenac, you will not put it. But diclofenac causes the decrease of amniotic fluid in the baby. So that has to be avoided. So the safest drug in pregnancy is one which is absolutely necessary. Now that I have covered the basic of the most commonly asked questions, I would like to just concise it into the trimester-wise care in pregnancy. So basically, pregnancy is divided into 3 trimester, and it has its own unique maternal and fetal changes. So timely care is very important, and you should know what all things have to be taken care of in each trimester. Understanding makes safe and informed decisions, and regular checkups, nutrition, rest, and awareness are key throughout the pregnancy. So, this is how the first, third, second, and third trimester is divided: first 3 months, mid 3 months, and last 3 months. So, what is first trimester? It is from conception to 13 weeks. It is confirmed from the start of pregnancy confirmation, which can be confirmed by scan, that is the viability scan or the fetal heart rate when it comes, or beta HCG when if suppose it's not seen, then um, we have the blood test which is called a serum beta HCG. It is also a test which tells about the pregnancy, but has to be used judiciously, and only two values 48 hours apart tell us whether the pregnancy can be intrauterine, that is in the uterus, or can be in the tube also. Generally, the viability scan, that is the fetal well-being scan or the heartbeat scan, is done from 7 to 8 weeks. Now, what are the main conditions which we see in the first trimester? First is missed period, obviously. Nausea, morning sickness, fatigue, breast changes, frequent urination, mood swings, light spotting or cramping, food aversions or craving, bloating or constipation, headaches, and dizziness. So, all these things, if you combine nausea, fatigue, food aversions, bloating, these four things can be managed by your diet. Short, frequent meals, adequate hydration. If she's not a diabetic, can advise coconut water. Uh, Fluids, 3 to 4 liters. Some patients say that they cannot even tolerate water. Some small home remedies like ginger, sometimes any candy in the mouth, amla supari, all these things also help. Breast changes, frequent urination, and headaches. These generally go down over a period of time, which like if the pregnancy, like the pregnancy when advances over the 12 weeks, these all things go down. Frequent urination, you should only be careful that it's not infection. Breast changes, you have to avoid them to have a good breast support. And if the pain is severe, they can take a paracetamol also. For headaches, only paracetamol, no other medication is prescribed. If she is a known case of migraine, she has to see her medicine person. Now, why first trimester is important? Because it is the conception. Organogenesis happens in this time. It is very high risk for chromosomal abnormalities. So, drugs used at this time should be extremely careful. Not that the chromosome abnormalities and drugs are related, but drugs can add on to the any abnormality which can come in the baby. As I said, it is most susceptible to harm from medications, toxins, radiation, and infections. Most important screening tests occur in this trimester. The most important one is the 12-week scan, the double marker test, and the NIPT. Drugs which you can use in the first trimester is folic acid, toxinate for vomiting. Antibiotics should be at minimal dose, but the safest ones are cephalosporins. Antihypertensives, if she is an antihypertensive, needs to be changed by meeting a physician. Anti-epileptic drugs need to be changed completely. The doses need to be increased. If possible, they can go to on monotherapy, and they have to be told that the metabolism of anti-epileptic drugs changes during the pregnancy. So the effect may be less. So they have to be very, very careful and always a companion with a person who is pregnant with epilepsy. Anti-diabetic medication may need to be changed. Thyroid medication can be taken. Anti-allergics like cetirizine, Avil can be taken. Autoimmune medications like tacrolimus, azathioprine, there are few more, tacrolimus, most these two only, HCQ. These three drugs they can continue. So precautions: stop smoking and alcohol, folic acid, omega-3 acids daily, lifestyle changes, and routine blood tests. Routine blood tests include hemogram, HbA1c, thyroid, viral markers, hemoglobin electrophoresis. Now, few more questions. Hair color can be done or not? Yes, most of them neo dyes are quite safe. X-rays avoid, but if necessary, can be done with a shield. Coffee, yes, you can drink 2 cups of coffee a day, but be sure that there is no other caffeine going from cold drinks, tea, and other caffeine-induced agents. Eat for two, no. Eat for one, but adequate nutrition. Warm bath, yes, if comfortable, not hot, but warm, yes. Another most common question is intercourse. Is okay if there are no other complications like no other vaginal bleeding or there is no other history of previous miscarriage. Second trimester of pregnancy is the honeymoon period of pregnancy. It is from 13 to 27 weeks, the fourth, fifth, and sixth months. Eyelids, eyelashes, nails, hair, sex of the fetus is visible, and the fetus starts moving. So you have to make aware the mother of the fetal movements also. There will be a rapid growth, movements will be felt, senses will start. There will be physical and emotional changes in the mother. The first trimester symptoms may subside, and new symptoms, possibly aches including back pain, ligament pain, swelling, and heartburn, may start. So here comes the role for our physiotherapist friends. They have to help them with the physiotherapy to reduce all kinds of back pain, ligament pain, and heartburn. So there can be bleeding gums, meter dentist, nosebleeds, or nasal congestion. These are due to hormones, but if it is persistent, you have to meet a physician, get your BP checked. Skin changes, like noticing a linea nigra down the middle of your belly, darkening of your areola. So this is the preparation of lactation. Round ligament pain is very important. You have to tell them that it is the stretch pain because of the ligament, which is attachment of the uterus. There may be some swelling in the hands, feet, and ankles, but if it is increasing very rapidly, you need to meet your medical provider. Stretch marks may start. Another question I forgot to write in this is stretch marks. See, stretch marks is dependent on the collagen. So everyone will have differently. You cannot prevent them basically. And you can be an increased risk of infections like UTIs. So drink water, adequate drinking of water, avoid using public toilets, and increase vitamin C in your diet. Most important blood investigations, OGTT, that is the sugar test, anomaly scan, which you can see the baby beautifully and sees all the organs of the baby. Tetanus toxide, start of iron, calcium, vitamin D. This would be continued it starts from 15 weeks and you have to continue it till the pregnancy, and 3 months after also you have given birth. Drugs which we can use in second trimester: iron, calcium, vitamin D, omega-3 fatty acids, anti-allergics, antihypertensive, anti-diabetic, anti-epileptic to be continued, autoimmune medications, thyroid, and Tdap. That is the second dose of tetanus, diphtheria, pertussis to be taken at 28 to 32 weeks. Precautions in second trimester: attend regular antenatal checkups, eat balanced diet, take medications only on doctor's advice, stay active with safe antenatal exercises, posture, avoid alcohol, and seek medical help for bleeding, pain, or reduced fetal movements. 3rd trimester, the most happiest period of, we're just waiting for the baby to come out. So 27 to 40 weeks, the baby can see and hear, talk to the baby usually drops, so the mother will feel like there is a lightning, she may feel that the weight has a little reduced. There may be again physical and emotional changes because she's very worried about the childbirth. Very careful about hypertension in this part of the pregnancy. Most of the patients who have been screened at, if the first trimester investigations are done correct, they will be screened at the first trimester if they have a high risk for developing preeclampsia. Danger signs to watch for: vaginal bleeding, severe swelling, intense abdominal pain, and significant decrease in fetal movement or a very high fever. Investigations to be done: CBC, fasting post-lunch blood sugars, and urine. Drugs, iron, calcium, vitamin D, omega-3 fatty acids can continue, anti-allergic can be taken, anti-hypertensive, anti-diabetic, autoimmune, thyroid medications to continue. Few more frequently asked questions. Is the swelling normal? No, if it is very increased very suddenly, or you have a weight gain, or you have puffiness of your face, then you have to meet your medical healthcare provider immediately. It may be a sign of preeclampsia. Exercise should be stopped? No, not needed. You have to continue your walking and your those exercises which you can do regularly. Movements, very, very important. You have to be very careful of the movements of the baby. If less, meet the healthcare provider. Does heartburn say that the baby is going to be hairy? Doesn't say, and no medical literature says that. Does any cream prevents stretch marks? I don't think so, but if you keep it well moisturized, maybe because of the scratching will be less, it may help. And for my dear physiotherapist friends, please explain all these exercises to our mothers: antenatal exercises, posture correction, management of back and pelvic pain, breathing and relaxation techniques, and preparation for labor and delivery. Physiotherapists play really a very, very important role in pregnancy, if you ask me. So, it would be very, very helpful if these kind of small lectures are taken for the antenatal mothers. We do have it at Fernandez Hospital quite regularly. Take home message: right nutrition, safe activity, and proper medical advice. Avoid myths, avoid self medication and unnecessary fear. Trust your healthcare team and your body. Thank you.
Dr. Gauri, over to you for some question and answers on this. Thank you, Dr. Vishaka.
Thank you, Dr. Vishaka. It was a very insightful session. I think you've covered all the points. We
Thank
have
you so
a
much.
few questions coming from the
Sure,
audience.
sure. We'll
So
take
we
them.
shall take up one by one.
Yeah.
So first question is, usually gynecologists fix delivery date according to last menstrual period.
Yes.
And by 40 weeks, if there are no signs of natural labor, they
Hmm.
suggest LSCS. How far it's safe to wait beyond 40 weeks to wait for natural labor?
See, normally there are guidelines which are given from RCOG. See, we don't have, even for Foxy also has guidelines. We at Fernandez Hospital, we follow 40 plus 6. So if a mother is low risk, that means she does not have any BP, sugar, any previous miscarriages, no cerclage, twins, all, I mean, as I said, high risk and low risk. Suppose if the mother is low risk, we can actually wait till 40 plus 6 weeks. Directly going for cesarean, I don't think is required. We can induce. There are multiple methods of induction available. So talk to your medical health care provider. They will let you know.
Thank you, doctor. The next question is, are certain natural foods like papaya, drumsticks, pineapple, etc. to be avoided during pregnancy? Because I personally was given a list of foods wherein one gynecologist had told me all this should be completely avoided during early pregnancy, and second one said you can eat everything but in limited amounts. So,
Yeah, that's
uh,
what I would suggest. See, papaya seeds. That's also raw papaya seeds were used as abortifacients in earlier times. So, we don't know the amount of papaya needed actually for causing an abortion. So that is why they say that avoid papaya. The second thing which is related with papaya is it may cause loose motions for some who are very, very prone to, because it's kind of a laxative. It helps in removing constipation also. So not in very large quantities, but small quantities you can take. Again, for the same for pineapple, it has bromelain, which softens the cervix. So less quantity is not going to do anything. Obviously, you're not going to eat kilos and kilos of pineapple. Anything in moderation is okay.
okay. Thank you, doctor. Our next question is, how do we know the 5 to 10 kgs weight gain in pregnancy is due to fetal development and not the mother's body weight?
That there is no, see, when you do your there are growth charts available in the scan. I mean, there is a software or what we can say which we follow, how the baby is growing. So the baby will always be provided with whether the baby is falling under 5th centile or it is between 5th or 95th or above 95th. Above 95th is more weight gain, less than 5 is less, and in between is normal. So they will tell you that the baby is gaining weight properly or not. Approximately 5 to 6 kgs is of the placenta, baby, blood changes, all those things. So rest of the would be the mother's weight gain basically.
Okay. Thank you, doctor. Next question is, what about riding a bike or bicycle during pregnancy? What would you suggest about it?
How good
Is
the
it
road
safe?
is, how good the road is. It all depends on that basically. Why? Because too much of, and how much you're traveling. Another thing. See, some are second time mothers who first child is going to a play school, which is very near. So it's okay. If you can tolerate the traffic and you safe driving, and it's not like 15-20 kilometers of driving, you can do. And the roads are good, obviously.
Okay. Thank you, doctor. Next question is, besides high mercury and allergy prevention, are there any other reasons why seafood is avoided?
No, no. Main is,
Because
sorry, main is high mercury, and most of the people will be, suppose you eat lobsters, they're very allergic, basically. So those, see, it's all where you live, basically. In people living in Goa will obviously not be allergic to seafood or fish or anything. But high mercury food is the main reason that we say to avoid a large quantity of fish.
now they
Those who are
usually
not
say prawns or crabs induce some cramps. So are they
cramps, and they
specifically
are
to be
very
avoided?
allergic. They are actually very allergic. That's the main reason. That sometimes now what happens is you are sitting in a restaurant and having your meal, and whatever you have a very high reaction, and you suddenly have laryngeal edema or you have problem in breathing. So those, to avoid those things, basically we say that it's better to avoid large quantities and anything new, basically, which you have not eaten anytime.
Yes, true. Thank you, doctor. Now, next question is are there any signs like constipation or bloating after taking, if there are any signs like this, constipation and bloating after taking multivitamins specifically during pregnancy, can this essential nutrients be managed only with the diet?
Yes.
Or is it,
Yes,
is it
yes.
essential to
They
take
can
this
be easily
multivitamin?
managed with your own diet. You have to be very careful of what you are eating. If you eat nuts daily, if you have sprouts daily, then all your micronutrients are almost covered. You need not have any special medication for that. That's the thing. Easily, they are almost all available in your diet, almost all. B12 is a little difficult to absorb, I mean, in the vegetarian diet specifically. So that may need a supplementation. But otherwise, if your stores were good prior to conception, you need not do that also. If you eat enough of sprouts, if you eat enough of plant protein, if you eat enough of nuts, that should be enough.
Thank you, doctor. Our next question: how common discomforts such as morning sickness, back pain, leg cramps, swelling, or breathlessness can be managed by self?
Um, Almost 70%, I would say, can be managed by self. Because, see, when you talk about, suppose vomiting, morning sickness. So it's basically if you are having long hours of break, I mean, hunger, that will increase your morning sickness. You will have, it's said to be morning sickness, but you can have that sickness any point of time in the day. So basically, when you are hungry for a long time, you have not eaten for a long time, if you observe carefully, you will have it more then. So you have to have short, frequent meals. When you are dehydrated, you will have more. So those things, if you avoid, it can be 60-70% with, and with a little bit of medication like doxynate, you can manage morning sickness. Breast tenderness, I agree, few ladies really have a tough time managing it because sometimes the tissue becomes so sore that it even touching it becomes an issue. I agree to that. But good support bra would really help you. Warm showers, good support bra. If it's really painful, then maybe a paracetamol may help you. Constipation again is completely on diet. Only thing is, those people who are prone to constipation prior to pregnancy will have more during pregnancy because progesterone again is a constipating hormone basically. So increase your fiber diet. I'll have a lot of fiber. It will help.
Okay, doctor. Thank you. The next question from the audience is the low pressure during air travel have any impact on the pregnancy? Does it have
Not
any impact?
much, not much in when you travel in the second trimester and you are not associated with placenta previa or twins or previous history of any abruption or anything of that sort. It doesn't. Fair enough to travel by air also.
Thank you, doctor. Next question, effect of using cosmetics and makeup during pregnancy. So we have a lot of,
I know.
pregnancy safe brands like Orimi in market. So is it safe
Hmm.
to use during pregnancy?
See, if they are marketing it as pregnancy safe, you have to. The basic thing is, I don't know if anybody has researched on that. Actually, it can turn out to be a very good research topic because we need to see what contents were used before. Most of we don't know what contents are used in non-pregnant things. But obviously those cosmetic items also, like they have, you're going to put it on your skin, so those which you have not used before, better to avoid them. Those, continue with those which are used in a good company, that should be okay.
Thank you, doctor. Next question is, what about women suffering from epilepsy? So those women who
Yeah.
are having epilepsy already, do we
Hmm.
need to advise them special care, or do they need
Yes.
to take some
Yeah.
special care?
Yes. Very necessary. This is a very good question, because epilepsy, first, they should avoid pregnancy for 1 year from the last episode. So 1 year, at least 6 to 8 months from the last episode of the fit. One thing is that. Second thing, all epileptic medications are not safe in pregnancy. They cross the placental barrier and affect the baby. So, neurologist involvement is very, very necessary, whomever they have been seeing since long or who have been treating them. Their pregnancy, the epileptic medications need to be changed. The dosage needs to be changed, because the enzymes which metabolize these medicines work differently during the pregnancy. Fourth, they should be very careful while traveling, and they should always be accompanied. Though epilepsy most of the time remains stable if it is well controlled prior to pregnancy, but still, yes, epileptic patients need neurologist involvement during the whole pregnancy. Every trimester they should visit once if they are not asymptomatic. Obviously, if they throw a fit, then the involvement increases more.
Thank you, doctor. The next question is, can doing repeated 3D or 4D ultrasound scans be harmful?
No, they are sound waves, not at all. They are sound waves. You can see your baby as many times as you want.
Okay, thank you. The next question is, can a pregnant lady have collagen or protein supplementation along with oil massage to avoid stretch marks?
Um, Collagen, I'm not very sure, but oil massage you can have very lightly, not on your tummy. Basically, stretch marks will be on your tummy. Not much pressure should be put on the tummy, I feel. If
Okay.
light massage, yes, you can do it yourself. You know how much pressure to apply.
Okay, how about protein supplements?
Yes,
Because they are
yes.
mostly advised with added sweetness and flavors. So, can
See,
you
protein
suggest any
supplements, when
particular?
I do my own research, I feel first of all, they're added with sweeteners. That is one thing. The other thing is, they are very habit forming, because they're very easy to use. You can just put a scoop, you'll get 10 gram. Put a scoop, you'll get a 12 gram. So you don't
Hmm.
improve your diet. That is
Yeah.
the problem with that. Using protein supplements, why we say not to use is, you don't improve your diet. Ho gaya 20 grams, ho gaya 30 grams, ho gaya one scoop. So that decreases your fiber content, that decreases your micronutrients, which you may even get with, like, suppose if you are having a bowl of paneer or you're having a bowl of sprouts, you will also get micronutrients, but all protein supplements may not have that. And your
So
water content,
natural.
your fiber content decreases. So again, constipation
Yeah. True. Naturally prepared food will
is always better,
always have
always better, always better.
better. Yeah, exactly. So our next question is, in IVF patients, which trimester can we start the exercises?
See, IVF patients may, there are two kinds of IVF patients. One is those who have had miscarriages prior and had the IVF, or though didn't have any pregnancy anytime, or those who have any surgeries on the uterus and had an IVF. So those category will differ. Suppose there is a lady who had a septal resection for a uterus or a myomectomy, that is removal of fibroid. You have to be very careful with those exercises, because they have a scar on the uterus, like having a previous cesarean. Or those who are, suppose if the age is more than 40, then they automatically become a little high risk. Third, twins, they are a little high risk. So as I said, exercises are which your body can tolerate. You do that intensity test. If you can talk while you're doing an exercise, you do it. Otherwise, no. If you have a cerclage, like a stitch on the cervix to prevent miscarriages, avoid those, because previously your uterus had dilated and delivered the baby prior to the date, because it's not very it does not hold the baby properly. That is why we have put a stitch. So avoid exercises at least till viability, that we consider 28 weeks. After that, light exercises maybe you can start.
Thank you, doctor. Our next question is a personal question coming from audience. They're asking, in my NT scan, the report said nuchal translucency is 2.14 mm. Is
Hmm.
it high?
See, nuchal translucency has to be matched with your age, ethnicity, nasal bone, tricuspid regurgitation, and your double markers. It's not never a single report. So you meet your healthcare provider; they will
Mhm.
help you with that.
Thank you, doctor. Now, another one says, how about physiotherapy exercises during cord around the neck at the time of delivery, at the time of labor? Are they safe?
La- Labor may there will be certain birthing position exercises. Those you can, you can do, because while you're laboring, your baby's heartbeat will be monitored. So if the baby's heartbeat is deranging because of the exercises, the person who is delivering you will ask you to stop. You can actually birthing positions you can take even if there is a cord around neck, because in some most of the babies after delivering we find out that there is cord around neck. We don't even report it in scan at F Fernandez.
Okay. There's also one more question related to this. So, after water bag breakage, can we
Hmm.
go for labor exercises for easy delivery?
Yes, you can. You can. See, water leakage itself is a form of what do we say, induction only. Okay, so if you have broken the waters, that means you had pains. Maybe you didn't feel it. That's the only thing. You will have some amount of pains or contractions that the water has broke. So you can exercise. You can do the birthing exercises.
Okay. Thank you, doctor. Our next question is, gynecologists mostly suggest Shatavari post delivery. Can it be taken somewhere during the third trimester?
I have
Usually
I have
for
no idea about.
lactation.
I
For
have no
lactation, it is given usually.
third trimester. Say I would not advise if it's taken for lactation, because if it starts lactation, that will be the that will give your body the signals that the labor is near. So I would like to avoid. I actually don't have any say on these medications.
Many had suggested me also. So actually, my I got loose motions after taking it, so I
That's
stopped
what
completely during
we
pregnancy. So
see.
afterwards, I started. That
Everyone
helped in
responds
lactation. Yeah,
differently. I'm not saying that those are wrong or anything. That just that I don't know.
yeah,
That's the
sure.
main thing. I have never read about them. I don't have a literature to support them. So that's what that I don't know.
Yeah, and something that is not evidence backed up, it's better to avoid.
Yeah, better to avoid. And specifically when the baby is inside your womb.
Mm.
Afterwards, it's only that you will be suffering, not the baby. Even if you have a loose motion, you will be having, not the baby.
Thank you, doctor. Next question is, intercourse around 36 weeks will
It's
help
okay. Yes,
normal
it
delivery?
does. It does. It does. It releases prostaglandins. It does.
Okay. And last question. A post-delivery depression nowadays it's common. So how can we help with the same?
See, that's a very good question again. Post-delivery depression is very common one, because so many mothers are living alone because of the nuclear family setup. You don't have support. Even if your mother-in-law comes in, they come in the end, or obviously they can't also leave their home and come and stay with you. So you have to build your own community first of all. It, as it is, the most famous saying is, it takes a village to raise a baby. So that's actually true. It does really take a village. So build a community. Other thing is, when you are with your when you have your own community, they know that you're pregnant, they'll take care of you, and you are also in some part of your mind, subconscious mind, you're sure that somebody will come if something happens to me. So mentally a little security is obviously very necessary. The second thing which I feel is medically, this is social aspect of it. But what is the medical aspect of it? We have to identify those mothers who can land in postpartum depression. Postpartum blues is different than postpartum depression. Postpartum blues everybody will have. Those you will recover by your own. You will understand that yes, this is because of the changes, and once you establish the lactation, you start feeling a little healthy. Eventually, it will go. Depression won't. So, identifying women, there is certain questionnaire available for mental health screening of antenatal mothers also. Those have to be done in the antenatal clinics to identify those mothers who will be susceptible to this postpartum depression. So once you identify those women who are susceptible to this, you can then help out with counseling. There will be drugs available. There can be antidepressants can be given during lactation also. Then you can help them. The main thing is to identify them.
Thank you, doctor. We have covered almost all the questions. Thank you so much. It was very comprehensive.
Thank you so
Uh,
much. Thanks for having
over to
me.
yeah, over to you, Dr. Sadhvi.
Dr. Riddhi.
Thank you, Dr. Smarnika, and thank you, Dr. Gauri. Thank you, Dr. Vanshika, for giving us such a nice webinar. It was very informative. We really got a lot of knowledge from you. Thanks a lot. I would lastly thank all the participants for attending the webinar. I would like to bring it to your notice that we have the next webinar on 15th by Dr. Sudhini on physiotherapy in first and second trimester with practical demonstration. Thank you, Dr. Vanshika, once again. Yeah.
Thank
I
you.
would
Thank you
like to
so
just
much.
correct, she's Dr. Vishakha. Sorry, ma'am.
Thank you so much.
With this, we have
Thanks.
come to an end to the session. Thank you, everybody, to give us time on